Hello, and welcome to Chapter 9 in Healthcare Supervision. We are talking about performance management in HIM. Now, this chapter, I'll be honest with you, this is probably one of my least favorite things about management, performance management. Sitting down with employees and telling them, hey, you did a great job, or hey, you did a terrible job, this is what you suck at, and this is what you need to do better, and nobody likes that. You don't like it as an employee, you don't like it as a manager, but it is so valuable and so important to the health of an organization, whether it's a healthcare organization, whether it's any kind of business. Your people, your employees are your greatest resource. And so managing their performance is essential to the survival of your business. So if you want to follow along, of course, in the chapter, we're starting with the definition of performance management on page 179. So performance management is a set of tools and practices for setting performance goals and designing sustainable job improvement strategies with employees, monitoring employee progress toward job performance goals with feedback, and coaching by managers and measuring individual or group performance. Now, I want you to just be sure to read through these, the highlighted terms, the bolded terms in this section. So be sure you can define job performance standards, performance appraisals, and basically this chapter, we're going to start in this little first section here talking about the human resources aspect, what they play in the role of performance management. And then the second section is going to be the performance appraisal life cycle. And then we're going to talk about different management tools utilized in your healthcare organizations. The third section is going to talk about the actual completion of performance appraisal documents in the HIM manager's role. And then our last section, we're going to talk about the outcomes of performance appraisal process. And that's going to include our self-appraisal and pay for performance. So let's dig into human resources here. Now, the HR department or your human resources department typically utilize a standardized performance management plan to handle employee performance on a regular basis. The HR department, along with executive management, develop the performance management process for the entire organization. Now, not only are you doing this to monitor the performance of your employees and to check on their productivity and how are they doing quality wise, you have to do this because accrediting bodies require it. They require employee performance appraisals to be provided, that they're actually to basically be the evidence that you are meeting the accreditation standards in regards to employee performance. Okay, so Joint Commission, CARF, probably several others that require ongoing employee review. Now, performance appraisals are an important component of an entire performance management ecosystem within a healthcare organization. These appraisals provide confirmation of an employee's performance by providing standardized documentation that allows for individual performance comparisons from year to year and allows for comparisons between individuals with similar jobs. So not only do we get to see a historical timeline of how we have done in our position over the last 2, 3, 4 years, but we also can have that comparison to our coworkers. So if I'm an outpatient coder and I have 7 coworkers that work side by side with me, then we can compare my job performance to their job performance. And of course, in any organization, in any business, you're going to have top performers and you're going to have low performers, and then you're going to have those that are just hanging out there in the middle. Now, these provide a common basis for evaluating an employee's promotion readiness by reflecting on competency and job task mastery for particular jobs. Performance appraisals provide standardized documentation on an employee's soft skill ratings, their ability to work in teams, and their ability to meet or exceed competency standards throughout the evaluation period. They also open the communication lines between an employee and a manager by allowing the employee to provide a self-appraisal. Basically, that's a document where you get to highlight all the good things that you did for the year, whether you met your goals or exceeded your goals, or special projects you were a part of. But this is where you kind of get to toot your own horn. All right, now the major components involved in developing a performance management plan, first of all, is you want to make sure that your job descriptions are updated. Okay, they need to have the current major task or functions outlined for each job. Then you need to determine your performance standards for each major task or function. And then evaluating performance based on the process of components outlined by the performance appraisal. So some of these could be the length of the evaluation period, which is typically a year, the timing of the evaluation cycle, interim contact points for assessing performance. So I know North Mississippi Medical Center, it's a 3-step process. You have your planning period, then you have coaching, which is usually done mid-year, and then you have your review cycle at the end. All right, so let's talk about that life cycle. So again, this is still very similar. Again, terminology may be different depending on where you are and what company you work for, but this 3-step appraisal life cycle falls in exactly with what I was familiar with at North Mississippi Medical Center. We start with planning. So we're planning what each employee is going to do, or each job is going to do. And then again, there's going to be periodic review. I may set up a monthly meeting with my staff, or I may set up a quarterly meeting with my staff just to say, hey, so far for this fiscal year, you are right on track with productivity, but your quality's dipping just a little bit. Let's work on getting that up this next quarter. And then again, the annual review. That's going to be the end of the year, big bang. This is how you've done for the whole year review. All right, so let's talk about that on 181. The performance management plan is the stepping off point for providing management. It starts with the baseline information regarding the employee's performance. The plan encompasses a performance appraisal lifecycle that begins upon an employee's hire and continues throughout his or her tenure at the organization. Some synonyms for the performance appraisal process are employee annual evaluations, professional development planning, and merit rating. The life cycle of the performance appraisal is depicted here on page 181 in figure 9.1, and it's also in our slide deck, as we can see here. But again, we start with planning. We're setting the performance goals based on the employee's job description. So this tells them what is expected of them throughout the year. The next phase is a periodic review, where I will collect information on my employees on a regular basis, and then again, kind of give them that progress report. Hey, productivity's awesome. Quality, not so much. Let's bump that up. Or, hey, you're right there. You're almost meeting that productivity goal. What can we do to get you to bump over that edge? And then again, that last phase, you have your annual review. Again, it wraps everything up, and you go over the whole year's performance. All right, so we're going to go ahead and move on to the performance management tools located on 182. So typically, these tools are developed and housed within your HR department. But you need all of these things to help manage employee job performance. So first of all, you got to have a job description. Okay, so you need to know the responsibilities and tasks for each position. So you know whether or not they're meeting the goals of the job. Okay, second, you need probationary performance reviews. So after that employee has first been hired, typically there's a probationary period, where if they're just not cutting the mustard, then they get to be sent home, basically. A lot of times that's a 90-day period. So then you need multi-source feedback forms. A lot of organizations are really big on this now, is you get feedback from their peer group. At North Mississippi Medical Center, we would allow our staff to send us names of people that they wanted us to reach out to for feedback. So if they had a really good working relationship with another area in the department, and it was somebody that they work with on a daily or a weekly basis, then they would give us their name and we could send out a feedback form to that employee. Now, I'm not sending employee feedback forms out to just the people my employees picked. So if there's somebody else that I know they work with just as much, I'm going to go ahead and send one out to them too, because employees tend to want to cherry pick. Hey, I'm going to pick my friends. I'm going to pick the ones that I know like me, and I'm going to just get great reviews. Well, that's not the way the real world works. You work with everyone, so you're going to have that broad range of feedback from different peers and different peer groups. Okay, the next one, your performance appraisal forms. So this form contains job responsibilities and tasks that are outlined in that job description and the job standards against which the employee is going to be measured. So this is a standardized form that's going to be used for everybody in the healthcare organization, but it's going to be modified down to you as an employee and your job description. And then you have your performance improvement plans. So these are standardized plans initiated based on negative performance outcomes. So job performance standards that must be met and improved in order for you to keep your job are going to be outlined in this document. Okay? All right, let's move on to our next section. We're getting into our performance standards. So performance standards measure work performance and the stated expectations for acceptable quality and productivity associated with a job or a job function. Now, our job descriptions are the basis for our performance standards, okay? So depending on what our job is, that's what we're going to do. So that's where we start when we want to go look for our performance standards. There are 4 dimensions of performance that should be measured in a performance management system and evaluated on an annual performance appraisal. So productivity, quality, timeliness, and fiscal responsibility. So productivity and quality are typically the biggest, because as an employee, we're going to use a coder as an example, I need that coder to be productive, because the more charts they code and drop off to the billing office, the faster the hospital is going to get paid. So again, quality, I want them coding those charts accurately. Now, timeliness, of course, is going to include not only your timeliness to work, but also the timeliness of how you get work done or how you respond to things. And then a fiscal responsibility is you're not wasteful, you're not wasting your time, you're not wasting company time, and you're not wasting resources. Now, the sources of the performance data for our job task, we typically get those through work sampling or benchmarking. So work sampling may not necessarily be as familiar of a term as benchmarking is, but when we go through this explanation, you'll understand a little more about what work sampling is. So this is where we're going to, and I'll just say this, it's math. We're talking about statistics here. So we're going to review a portion of task performed, and we're going to get a baseline for that work, okay? So we are going to calculate the average time for completion of coding an inpatient record, okay? So I may give 5 coders 10 charts, and I'm going to get an average of how long it takes to code one chart. So that's work sampling. You would do the same thing for other areas in the HIM department, whether it's outpatient coding, whether it's release of information request, transcribing a dictated report, scanning your records, analyzing a certain number of charts per hour. So again, it's a statistical method of determining what the average amount of time or the average number of things that should be completed within a specific time frame. Usually in the HIM world, It's done in hours, especially when we're talking about coding. Release of information could be measured in days because you have 30 days to respond to a record request. So usually you would measure that in days. Transcription, you may cover that in hours, or you may cover that in minutes, depending on what you're measuring. And then, so now moving down to benchmarking, which should be, again, another familiar term. So we're looking at the measurement that takes into account the quality aspect of completing a job task from start to finish. We can develop this internally within the HIM department, or we can reach out to other organizations. Now, HIM managers often solicit other HIM departments to compare coding quality, document imaging quality, and release of information turnaround time benchmarks. And now I want you to be familiar, not specifically, going forward, but just for sake of this test, on 183 you have table 9.1, and these are some examples of job performance standards, and these are typically spot on with industry standards here. So for example, if you had a medical request for information, your release of information clerk, their performance standard should be to turn that work around, so send out that request for information within 4 days, 3 days, how many ever days you choose as an organization to be your standard, with 98% accuracy. Okay, coding inpatient records, we want 95% accuracy on our coding, and for an inpatient we want to be at 3 charts per hour, or 3.2 charts per hour for our chart here. Outpatient, again, 95% accuracy for outpatient coding, and we want to code 6 charts per hour. All right, chart analysis, look at that one. 98% accuracy here. So we want to check our chart and ensure that there are no deficiencies. We have all of the documentation needed for that chart. If that patient had surgery, we have an operative report. If that patient had a consultation by 3 different specialists, we want to ensure those consultations are on the chart. We want to make sure all of our documents are signed, dated, and timed. And so inpatient charts, we want to analyze 6 per hour, and outpatient charts we want to analyze 10 per hour. So just be familiar with these different work or tasks, and the quality accuracy and the quantity performance indicators. All right, moving over now. When we start talking about our different performance standards, we need to ensure that these are SMART. We've talked about SMART before. This should not be anything that's new, but SMART goals means that it should be specific, measurable, attainable, realistic, and timely. So basically we're saying it can't be some ambiguous thing that you can't measure, and it's just so over the top that you're setting your employees up for failure. You know they can't hit 100% accuracy all the time. Nobody can. We're all human. We make mistakes. So again, specific, measurable, attainable, realistic, and timely. Let's look at an example on page 184. So it gives us a sentence. It says types operative reports with 95% accuracy on all inpatient encounters within 24 hours of the surgery. That is so specific. It's talking about operative reports. It's measurable. I can measure whether or not that transcriptionist has 95% accuracy, because within my transcription department, I've got quality assurance going on. And I know whether it was done within 24 hours of the surgery. Okay? So 24 hours of the surgery is timely. I have a time bound to my goal in some manner. So I want to ensure that I'm meeting that 24-hour turnaround time. Okay, let's get on into performance assessment here. So job performance has a dynamic component in which employees can experience either short-term or long-term variances in job performance. While employees may experience variances in job performance over the years, their perception may be tainted in that they feel their performance remains stable over time. Now, it talks about how it's important to assess individual job performance regularly, as required by the job, so that we can see these variances and they're caught early. Our example in the book on 185 is an HIM coder's productivity and quality should be assessed on a weekly basis to monitor varying trends as they occur, while a coding manager's performance would be assessed on a monthly basis as she reports the coding area's productivity and quality to her manager. An example of a job variance in the HIM department would be when a document imaging specialist's quality decreases for a month or two, so that's a short-term variance. Or when his or her productivity for the year does not match the previous year's overall document imaging productivity. That's long-term. So if we see dips in productivity that last for a month, maybe two, that's short-term. But if their productivity is down month after month after month for a whole year, then that's long-term. Early intervention of variances in job performance allows management to intercede quickly and provide additional training, support, or resources to negate the variances. Short-term fluctuations of job performance are often related to situational cues, such as increased job complexity and issues related to resource allocation. Personal issues such as illness or loss of a loved one may also cause a variation in job performance. An HIM manager knows when variances are occurring in a work group by regularly monitoring employee productivity and quality job performance standards. So this routine monitoring allows the HIM manager to address variances in job performance and intervene with the employee early on before the overall job performance is impacted. Now, there is a direct relationship between job satisfaction and job performance, okay? A direct relationship. It is there. Situational strength, which is the cues that employees experience in their workplace that allow particular job performance behaviors to occur, provide a link between job satisfaction and job performance as well. The climate of the organization can fluctuate from very strong to weak. In strong situations, there are uniform expectations and adequate incentives for job performance. Employees have a common framework and know what is expected of them. In weak situations, there's no uniform expectations and they don't offer any incentives for performance. And the situation is not construed by the same by all employees, and there's not a common framework for performance. So just know, if you don't like your job or you are burnt out doing your job, your performance is going to suffer. So just remember, there is a direct relationship between job satisfaction and job performance. All right, so let's get into the physical working environment. Now, we have 4 broad issues that are associated with an employee's work environment. So first of all, we got personal space. That's going to encompass privacy and noise, and we're going to flip over to the next page here in a second and talk about that. We have spatial density or crowding. We have workplace personalization and identity. And then we have task or workflow interdependence. Now, again, HIM is a non-revenue generating department, and so it's not always been allocated an optimal work environment or enough square footage to handle all the tasks. So a lot of times, and you've probably seen in your clinical sites, that some of these places are kind of small and they're in older parts of the building. Sometimes HIM just gets the rough end of the stick, I'll be honest. You've got old cubicles, or just sometimes it's just old, and because HIM does not get the money, they're not bringing in money, so people aren't necessarily as willing to go out and update these HIM departments. So let's talk about that when we get into privacy. So our personal space, again, in terms of privacy and noise, so these factors can affect someone's job performance, okay? If you're sitting out in the middle of a room and people walk back and forth or talk, and you have no privacy at all, there's a lot of noise and you can't focus. So in a job, you need personal space. You need a cubicle. You need a place where you can go and you can feel that you have place to do sensitive work. You don't want just anybody walking by looking at your computer screen, especially if you're a coder and maybe environmental services comes in and starts emptying garbage cans. You don't want them to see the medical record of the patient you're coding, so that you need a little bit of privacy there. And then again, noise. Any sound that is undesired or interferes with one's hearing of something or concentration. So some people can work in noise and they have no issues whatsoever. And some people have ADD or ADHD, and the ticking of a clock will drive them up the wall and they can't focus and they can't concentrate. So personal space includes giving you some privacy so that your workstation is contained to you, and that there's not a lot of noise going on that disrupts you. Now, some people enjoy listening to music or need noise canceling headphones, and that's perfectly okay. All right, so let's talk about spatial density or crowding. So in reference to this chapter, we're talking about square footage, okay? Square footage that each person has to do their work in their work area. Now, if you've got a lot of people working in a small area, then you automatically have that perception of overcrowding. Now, allowing no personal space for employees can result in overstimulation and provoke conflict and emotional reactions between employees. And so, again, we're cultivating a negative work environment, and it's going to affect their work performance. Now, the positive side of having individuals performing similar jobs within that small area is it's going to improve communication and hopefully cooperation among the work group. So if I'm sitting in a room and we have about 9 cubicles in a room and it's a tight space, but everybody still has their own little bitty desk space, and we're all doing outpatient coding, and I come across a case that I've never coded before, I can just say, hey guys, what do you think about this? How would I code this diagnosis? So it allows for, that feeling of community because you are so close together there. All right, let's talk about workplace personalization and identity. Okay, you have walked by my office at some point in the last year and a half, and you see my cookie trays. I painted them. I've got my pictures of my kids, my husband, and that's my personalization of my workspace, okay? It allows individuals to decorate or mark their workstation with items of interest within reason, and it could be things like favorite quotes or pictures, or if I was a sports enthusiast, I could have, pictures of different athletic events, which I do. If you look at my kids' pictures, I've got baseball, soccer, football, basketball, everywhere. But that just allows the person to show their outward identity. If an employee decorates his workstation with sports memorabilia from their favorite team, this reflects to others that the employee enjoys sports or is invested in a particular team. Collectively, all workstations in an employee work group or department may provide an identity for an area as well. A messy work group or department may signify to others in the organization that this area is sloppy, or that this group cannot get their work done, as evidenced by piles of paper, charts, and such. So there is a connotation between the size of offices. So we're kind of getting into the identity now. Is if I've got that big corner office and I've got windows along 2 sides of my office and I have a beautiful view, you would assume that I am somebody, okay? So maybe I'm the CEO or maybe I'm the CFO, but that identity of space just kind of lets you know their authority or their position within the organization. If I have a tiny office with no windows, I'm probably not very important. Or if I just have, or I'm just at a cubicle and, I've got 6 other people surrounding me, I probably don't really have any authority. I'm probably not a manager. Managers typically have an office with a door that will close. Now, in a hospital, it's very hard to find an office that actually has a window, so windows may not necessarily identify people by their office, but typically someone with some authority in a supervisory or some kind of management capacity will have an office. And if there is no authority or no managerial duties, then a cubicle is a perfectly fine location for an employee to work. All right, so let's talk about task or work interdependence in the workplace. So it's necessary if the necessary resources are not located centrally to all employees completing the task, job performance can be hindered. Now, with the advent of electronic health records, physical interdependence of job tasks is not nearly as important to the completion of our HIM jobs in the past. So, in the past, when we had paper records, you had to analyze those charts for deficiencies, you had to code those charts, you had to get the physicians to come in and complete that. And when we're talking about paper, only one set of hands can be on that chart at one time. So that was a big hindrance in task and workflow interdependence. So once everything goes electronic, I can analyze that chart while the coder's coding and while the physician is in signing off on his history and physical. All right, let's move over to working from home. Now, these other 3 things here, working from home, job experience, and job complexity, they all do impact the work environment and the job performance. Now, working from home is a huge draw for the HIM program and your HIT programs because it is a job that you can do from home. So let's talk about that. Let's talk about what that means because it's not always sunshine and rainbows. When you think about it, there are strict requirements for people that work from home. Now, as more employees work from home in HIM departments, it's important to educate employees on the same topics for their home office. So again, we're talking about privacy and noise, spatial density, and personalization. Now, when they first set up their home office, the HIM manager should perform a visit in person or virtually to make sure the office is set up appropriately. Now, a long time ago, when our transcriptionist at North Mississippi Medical Center first went home, our director required that they take a picture of their workstation to ensure that there were proper ergonomics in place, like you didn't have like a TV tray set up in front of your couch with your computer sitting on top of the TV tray. You had a desk, you had an appropriate chair, and it was in a place that was relatively private. So, I don't have my work computer sitting right in the middle of my living room. So they would want to make sure that everything was set up appropriately. And if they lived quite a distance, then the manager should perform the site visit virtually, utilizing some kind of technology such as video conferencing that would allow the manager to see that work set up. Distractions in a remote work environment are not as easy to quantify, and their bearing on employee performance is not as evident as when the HIM employee works within the department. So really what that means is you can't have your kids at home with you and continue to work and do your job and be productive as always. And even though I look at your workstation virtually, let's say we FaceTime and you show me your workspace, well, that's Monday, but you have a sick kid on Tuesday. And so now your sick kid is crying because they're not feeling good and they want mom. And of course, you're not focused on your job like you should be, so your productivity is going to suffer on Tuesday if that kid stays home. There still needs to be that differentiation. Just because you work from home does not mean that you get different perks. And that's sometimes hard for those employees to understand. Well, I'm home. Why can't I keep my kid at home too? Because of the distractions, because of the noise. All right, now let's talk about job experience. So, job performance is also impacted by relationships between job experience, organizational tenure, and age. So, our job experience is the accumulation of job knowledge from action and practice and is linked to the tasks and duties associated with a particular job. So, job experience leads to the amassing of relevant knowledge, skills, and abilities that should positively impact job performance. Now, the paradigm of job experience has changed over the past several years as long-term HIM professionals acquire different skills. And so, of course, we have different technology. So when we went from paper to electronic health records, those skills needed to change. And as we have more computer-assisted coding programs going into place, coding skills change. And then, of course, transcription has changed greatly with the use of speech recognition. Now, let's talk about organizational tenure. This is an accumulation of work-related information from job experience, and the information gathered is only relevant to the current organization, climate, or culture. So I worked at North Mississippi Medical Center for 14 years in the HIM department, and I had a lot of organizational tenure. I took a lot of knowledge with me that was specific to North Mississippi Medical Center. That knowledge necessarily would not pertain to Baptist if I went to work at Baptist. And then age. Age is another aspect that can impact job performance. Now, we can't discriminate based on age, so don't get me wrong there. And then chapter 3, we talked about aging workforce. But the reality is that aging impacts how all individuals function in the workplace, ranging from deterioration in motor coordination and strength, memory, reasoning, and cognition to the motivation for developing new job skills. So typically, our older employees, they could forget things more easily than our younger employees. All right, and then job complexity. Now, job complexity is, let's put it like this. The harder the job is, the longer it's going to take you to learn it, and the greater the level of job complexity, the more difficult it is for the employee to acquire those skills necessary to perform the job. So let's just use coding as an example. That is a very specific set of skills that you have to obtain. Coding is not easy, and so coding jobs are harder to get because people want experienced coders or educated and trained coders. And so, again, the greater the level of complexity, the more difficult it is for the employee to acquire the skills necessary to perform the job. Think about any job out there that is complex. Being a physician. How many people go to medical school, make it through medical school, and become doctors? Well, a good number, but how many people go to work and become nurses? A lot more nurses than there are physicians, and it's because of the complexity. It's much easier to get a nursing job because you can go through a 2-year program and receive a RN instead of going to medical school and being in a residency or maybe a fellowship for, 10 to 12 years. So job complexity plays a big role in job performance. All right, let's move over to the completion of the performance appraisal document. Now, in healthcare organizations, the HR department is responsible for maintaining standardized performance appraisal documents that are utilized by everybody in the organization. We said that earlier. Now, when we complete, and I'm dropping down to the next section, when we complete our performance appraisal, we're going to have qualitative and quantitative data for each analyzed job task, okay? Now, qualitative is describing the qualities or characteristics of the job task. So we're talking about the quality of my work, the accuracy of my coding. And quantitative performance data is talking about the actual number of tasks that I completed. So again, quality is qualitative, and quantitative, that's where we're getting into my productivity, how much I actually did. Okay, so jumping over to page 189, performance appraisals will also include other items for evaluation, and many of these items are standardized by the healthcare organization. So we may have one section that delineates specific employee values that match the mission and vision, and they can be rated as met or not met. Some examples could be whether or not the employee is respectful, whether they're honest, if they're reliable, or if they work as a team player. And then we have specific job responsibilities that get evaluated. So this is going to include the major job responsibilities and the specific performance standards that were developed for each particular job task. So our HIM manager is going to compare standardized performance measures for all of those employees doing that task. So I'm looking at all of the outpatient coders, or all of the document imaging technicians, or all of the chart analysts. All right, and then we have our individual goals. So this is where I, as an employee, have my goals, my SMART goals, that are agreed upon with my manager, and that's where I say whether I did meet or I did not meet those individual goals. All right, let's move to pay for performance. Now, basically, this term refers to remuneration for job tasks completed throughout a certain time frame. Pay for performance programs can be a potential driver of performance and can also provide a way to differentiate employment from other healthcare organizations competing for the same job pool of candidates. The major component that makes pay for performance programs successful is in the way in which it defines and measures performance. One method of pay for performance that is utilized by most healthcare organizations is referred to as merit pay. Now, merit pay is an increase to our base salary, which is typically done once a year, and it's based on the performance appraisal ratings by my manager. So, if I got to get a merit pay increase, it's going to usually happen once a year, and it's because my manager rated me as doing a good job. Now, the concept can also be referred to as meritocracy. I think that's how that's pronounced. If it's not, sorry. Where employees are evaluated by positions and rewarded based on individual merits and contributions. Then you could also have performance ratings statistically related to the amount of merit raises. So read through that section. That pay for performance is pretty interesting, but basically it boils down to is if you do a great job for your organization and you go above and beyond, then you will be recognized for that. So you are paid for your performance. Perform well, get paid well. Perform bad, get paid bad. Now, pay for performance impacts performance in two ways. You have the incentive effect, and then you have the sorting effect. Now, the incentive effect relates to how pay influences the level or intensity of individual motivation toward job performance. The sorting effect relates to the effect of pay for performance on the composition of the actual workforce. So those are your differences there. All right, let's move on to the next going to get into the actual performance appraisal process over on 190. Now, this is the third component of our overall management system, performance management system. So, a lot of times, and I'm one of those, I admit, there are negative connotations associated with performance appraisals. And if you do not manage it appropriately, they can be a painful and emotionally charged process. Now, there are ways to minimize this, and we're going to get into that when we get over onto page 194 about what the manager can do to help kind of mitigate some of these issues. But really, let's get into the different appraisal methods here. So on 191, we're going to start with the critical incident method. Okay, this method involves maintaining a log or documentation of critical incidences, both positive and negative, throughout each employee's performance cycle. So basically, I'm keeping up with a tally sheet of every time you do something good, I'm going to write it down, and every time you do something bad, I'm going to write it down. So that's critical incident method. This is time consuming, okay? You've got to look at everything, and you've got to document everything that they do, good or bad, and then you have to share it with the employee at the time of the occurrence. Now, there are some advantages. You've got detailed incident documentation. It can be maintained and shared with the employee, again, for both positive and negatives. And there should not be any surprises if we let our employees know at the time of the incidents that they did good or they did bad. Now, a disadvantage is, again, this is so time consuming to document all of this information. All right, moving on to graphic rating scales. Now, this is the most common methodology employed in HIM departments. Checks or monitoring are conducted on employees' performance throughout the performance cycle, and the content of the performance monitoring includes their quantity of work, quality of work, dependability, judgment, critical thinking, cooperation, and initiative or motivation. Rating scales are designed to each key performance or assigned to each key performance indicator, and a typical scale might look like what you see over on page 192 in figure 9.2. Now, one advantage is this is definitely a less time-consuming way to develop a more subjective evaluation type, okay? So it's much easier for me to go and look. Where's figure 9.2? I'm sorry. 9.2. Wow. 9.2 is back on 188. But like, if I choose 4 points for exceeds performance, and I choose 3 points for on target, and I choose 2 points for needs improvement, I just select which area you fall into. And that's easily enough to go in and determine what your performance standard was, or how you measured up. Now, there are some common rater errors when you use the graphic rating scale. These are on page 191. So first of all, you have the halo effect. This is where we assess all performance for an employee as either positive or negative based on one specific aspect rather than overall. So I may have something stuck in my head that this employee did this year that was just fantastic. But that's only one thing. And so because I have that halo effect, I think that one fantastic thing just, it negated everything else, whether it was good, bad, whatever. That one thing just sticks out to me. And so, again, either positive or negative, it could be one bad thing that happened this year. And I don't look at any of the good because I'm focused on that one incident. Now, central tendency means that the rater feels that the performance of all employees should be rated as average rather than objectively assessing each employee individually. So central tendency means I'm going to give you the same rating as I give Sally, but I'm not really looking at anything you did individually. I'm just saying, oh, well, everybody was pretty average across the board. They all get the same scale. Then you have leniency or strictness. They lean one way or the other, tolerant or rigorous, when evaluating employee performance. And then we have our bias, or similar to me. They judge the employee's performance on how similar it is to their own performance. Okay, then we have our essay evaluation method. This is mostly applied in combination with another methodology, such as our graphic rating scale. It requires that the manager develop an employee appraisal by qualitatively identifying the strong and weak points of each employee's behavior and documenting each of these in a written essay. The information the manager may use when assessing the employee's behavior includes job knowledge, application of the organization's policies and procedures, working relationship with peers and management, their attitude, and their organizational abilities. So at North Mississippi Medical Center, that's kind of what they use as an essay evaluation method. It has a graphic rating scale for certain pieces, but then it also has an essay portion where your manager can write down the good and bad of your year. All right, and then we have our 360 performance appraisal. Now, this is most often used in conjunction with other more traditional methods, again, such as our graphic rating scale and our critical incident methods. It measures the manner and capacity of work performance and concentrates on more subjective areas such as teamwork, character, and leadership. The 360 performance appraisal method requires the employees obtain confidential and anonymous assessments from their colleagues. And so this is where I talked earlier about how you can tell me which peers that you would like your performance appraisal to be sent out to, and they're going to answer questions based on your work performance. So not only am I looking at you as a manager and determining, okay, well, I think you did this year, but you did that, and that kind of drug you down some, but I also get that they call it the 360 because it's a full circle of, trying to think of the word I want to use here. It's just that full circle of evaluation. You know, I'm evaluating you as your manager, and now we have these people evaluating you as your peers or colleagues. Now, advantages, it's more comprehensive because, again, it's not just my point of view as the manager, but it also gets the point of view from teammates. But a disadvantage is that it can be time consuming, and then you've got to send all those feedback forms out, and then you've got to wait to get them back, and if they don't do them, then you've got to send them out again with a reminder, and it's a time consuming process. Then we have a forced ranking. Now, this is starting to appear more frequently in healthcare organizations, and basically this means that you have allotted allocations for your employees. This means that only the top 10 to 20% of your employees are going to fall in a higher level of performance. And then 70 to 80% are going to fall in the middle. And then the rest of them are going to fall in the lowest levels of performance. So then you have high, middle, or low levels of performance. And they're based on the aggregate performance standard scores calculated within your annual appraisals. So, for example, based on the job standard scoring outlined in Figure 9.2 over on 188, a high level of job performance would be aggregate score of 3.5 to 4, a middle range would be 2.5 to 3.49, and a low range would be below 2.5. So, employee increases for next year would be based on the force ranking allocation, high, middle, and low job performance. Advantages is that it forces management to really assess personnel performance and categorize who your high performers are and who your low performers are. But a disadvantage is this is not very good for your employee morale. It discourages collaboration and teamwork, and it can create a more competitive and cutthroat workforce. All right, our last one is management by objectives. So this is another technique used in performance appraisals that addresses the assessment of performance at the management level. So, management by objectives is a management approach that defines target objectives for the organization and it compares the performance against those objectives. So, really, we're looking at this being a pretty participative approach to performance, and it requires goals and objectives to be defined, and then we're going to assess your performance against those measures. Advantage, collaboration and teamwork. You pretty much have to have it to make this work. But a disadvantage is if that one of your team members fails to achieve a component of the goal, then all of the team's going to be affected. So if we put a goal in place of having all coding achieving 95% accuracy, and you've got one person that only hit 92%, then everybody's going to be affected by that 92%. All right, let's talk about self-evaluation of performance. Now, performance appraisal we talked about is the manager's evaluation or the colleague's evaluation of your job performance. Well, another performance appraisal aspect is your ability to complete a self-evaluation. So, in order to engage employees during this appraisal life cycle, employees should be involved of assessing their own performance on a regular basis. So at North Mississippi Medical Center, again, it was a 360-degree performance appraisal. The manager, they were the ones reviewing an employee. They were sending out feedback forms to peers, and they also sent out a self-appraisal. So you, again, get to document all of the great things that you did during the year. So if your manager forgot that early on in the fiscal year you were a part of this huge project, then that's your time to send out that gentle reminder. Hey, remember I did this back in October and you didn't forgot about it because it's November of the next year. Now, here's some tips for writing your self-assessments. Be proud, okay? This is your time to highlight the things that you did well, okay? This isn't a time to be all meek and mild. This is a time for you to highlight what you did well. So be proud. Be proud of the accomplishments that you achieved. Be concise. Do not get all wordy. Be very articulate into what is a strength. Be articulate into what is a weakness. Don't try to sugarcoat things. Be concise. Be honest. Be honest about the things that you do need to improve. And be honest about the things that you did improve. And then be professional. Reflect on why your goals were not met and what you would need to actually attain this particular goal. So if you didn't make something happen, be honest. Be honest. You know, if you were told you have to get 20 continuing education hours and you have to schedule the time yourself within your work day, within your work week, within your work group, you know, be honest as to why that didn't happen. You know, it may be well and true that your coworkers are more tenured and they have more vacation time and you just didn't get to do it because you had to fill in for them being on vacation. But if everyone is not tenured and they don't have vacation and they work just as much as you do, then you should be able to make time for that. So again, be professional in how you communicate this stuff to your self-appraisal form so that your manager really knows the true picture of what happened. Managers should allow employees sufficient time prior to the actual performance appraisal process to provide these self-assessments regarding their job performance for that time frame, so the past year's performance. Now, when we're talking about communicating the actual results, this was the part that I didn't like it, and I don't like it because, again, it can be emotionally charged. Some people you can't win with. Some people feel like, oh, well, I hate this so stupid performance appraisal thing. They're going to lie about me. They don't like me. They're going to say bad things about me, and it's going to keep me from getting a raise, or blah, blah, blah. So you kind of have to be very proactive in how you approach this, and it's let's just read about it, okay? All right, flip over to 194 for me. Now, top sentence starting where it says upon hire. Upon hire, managers should be trained not only how to complete the documents, but on those soft skills required to communicate performance appraisal results. Monitoring and evaluating employee job performance is a key role for HIM managers, and they should be trained on the use of the healthcare organization's performance management plan. Now, dropping down into that next paragraph, the manager, when it's time for you to sit down with your employee, there again, we talked earlier, there should not be any surprises. Employees should know what happened throughout the year because they should get that regular coaching or that ongoing review. You want to sit down in a place that's quiet and free from interruptions. So if you're going into your office and you're shutting the door and your office phone's ringing off the wall and your cell phone's ringing, make sure all that's silenced. You want to give this employee the time they deserve when you're reviewing this feedback, okay? So make sure you allot enough time, okay? You can't just say, here's your performance appraisal, read over it and get back to me. It's not the way this works. Now, you should go through this with the employee, and they deserve adequate time and appropriate time for face-to-face interaction or feedback. They may not agree with something you scored them on, or they may not agree with your comments. They have to have that time to provide feedback. So constructive feedback should be provided in the performance appraisal regarding both negative and positive job performance. So that's you giving them feedback. But they also need to be able to give you feedback on their review. Now, during the appraisal process, the following should be done by the manager. So first of all, you need to have given feedback to the employee on their self-assessment prior to your meeting, okay? So before you sit down with them for a formal meeting, they need to have already been given information. You need to solicit suggestions on how the manager can assist the employee in reaching his or her goals. You need to develop new performance goals for the next performance appraisal cycle. Sometimes you don't always do this in one sit-down meeting. Sometimes you may wait just a little while and then sit down and do the planning phase for the next year, but sometimes you can go ahead and do them together if you have enough time. You need to solicit feedback on your performance as the manager, and then you wrap up the performance appraisal by thanking the employee for his or her contributions to the work group, department, and to the organization, because again, employees are our greatest resource. All right, moving down to the performance improvement plans. Okay, now if we determine that the employee's performance was not great, was not good, then we would need to have them initiate a performance improvement plan. So this is a strategic roadmap for the employee to utilize to achieve more positive results with their job. Okay, so the first step is documenting performance issues. Okay, so the manager should have objective documentation given dates or results of poor performance. So let's use the example in the book. If coding quality standard is to code all discharges within 95% of accuracy, and the last 2 months Sally Coder was at 92% and then 88%, then we need to have a conversation, and there needs to be documentation that she didn't meet that performance goal for 2 months in a row. The second step, develop our action plan utilizing our SMART goals. Okay, so we know that she's not meeting her accuracy goal. So now we have to have a SMART goal in place of how she's going to increase that accuracy percentage. Step 3, review the performance plan with HR and your department director. So after you create the PIP, which is our performance improvement plan, the manager should review the actual plan with our department director and with the HR department. Okay? Now, HR will provide guidance on the duration of the plan and then the next steps if the employee's performance doesn't improve. Fourth step, meet with the employee to review their plan. So this should be a confidential meeting. You're not going over to their cubicle and talking about it while you got 15 other people's eyes on you. It's going to be confidential. The employee should be able to give feedback on their performance goals in the PIP, and they should be able to add goals too. Then the manager should provide training methods that's going to actually help this employee meet these goals. Step 5, follow up with the employee. You can't just hand it to them and say, here you go. You've got to check in. You've got to maintain contact there. And then number 6, last step, conclusion. We need to come up with a time frame. When do you need to be back on track? Do I give you one more month of leniency or what? Because sometimes, let's say that this was January, she was at 92%, and February at 88%, but it may be March 5th before I can say, well, you met 88% for February, because I'm waiting on the information, I'm running reports, etc. So maybe the SMART goal is by April of 2020, Sally Coder's accuracy will be 95% or greater. So again, that's SMART. It's specific, it's measurable, it's attainable because her other coworkers are not having any issues. So again, that's our 6-step process when we are initiating our employee performance improvement plan. All right, that mostly covers that last chapter, or chapter 9. So again, I didn't read all of this. I don't want to be reading to you, even though I read to you a good bit, but be sure to go back through this chapter. Again, recognize these key terms, understand these concepts, understand how you would apply these, or how you can recognize these out in the job force. Think back to your affiliations with your clinic or your hospitals, if they talk to you any about performance improvement or how their goals were set for their department. Think back to how you can kind of tie all this together, and think about it from the aspect of current positions or jobs that you worked in the past. Think about how they did performance management. So happy reading, and